Hey y'all, it's Maddie Gray. I'm here with Heather. She is my peptide expert. I'm about 2 weeks out from Miami Swim Week. I hit a little plateau. I was able to lose from 126 to about 120, and I got a little stuck. My body wasn't feeling it, and I really want to be my ideal physique for Miami Swim Week, so I needed a little bit of help. So I brought Heather here to kind of discuss some peptides and what our plan is for Miami Swim Week.
Awesome. Well, I'm so happy to be here, guys. And I'm Heather. I am an expert in wellness and somewhat biohacking. Maddie here obviously is in amazing shape, and so she was the perfect candidate for wellness and peptides. She already takes care of herself on the inside by eating right, drinking lots of water, exercising, and so peptides are really here to just help expedite that process and help it be more smooth. So let's hear about how your experience has been going.
So I have been on Semiglutide, 10 units per week. I've only done my first week so far. Keep you updated with everything, and then IGF-1. So with Semi, a lot of people can get really tired, and what we don't want is the Ozempic butt or the Ozempic face. So we want to keep that muscle tone. The IGF-1 is helping me keep my energy up so that I can get to the gym and recover. We were also going to do MOTS, but I haven't started it yet. So can you talk a little bit about why we would have done the MOTS as well?
Yeah, so with semaglutide, it's a great peptide. It's obviously going to help you lose some weight. It's one of the best to help cut calories and really regulate blood sugar. So it's actually created for diabetics and obese patients to help them regulate their sugar throughout the day so they didn't get hungry. So it works great for that, but honestly, it does have a lot of muscle wasting with it. So someone with your physique, we want to keep the energy up. We want to keep your muscle tone on because we don't want you to all of a sudden stop taking semaglutide and then you gain the weight back.
Right.
So we always try and pair that with muscle building peptides like an IGF-1 or a CJC of amorelin. MOTS is great because it works on the glucose side of things. So anything you eat, actually it can turn into energy. It's been awesome. And so when we pair those together, you won't have as bad of side effects. You still might have some of the nausea, but you're not going to have that muscle wasting. And our patients tend to, as soon as they come off the semaglutide, they don't bounce that weight back.
That's amazing. So I have felt that I can recover a little faster with the IGF-1 when I did my first couple of days of just the Semi because I was nervous. I woke up a little nauseous that first day, but I took a Zofran and then I never got that feeling ever again. I know some people have bad side effects, but coupling it with the IGF-1 has really canceled out those side effects for me. And so since I've added that in, I've been able to hit my workouts harder, and I'm not as sore when I wake up in the morning. So I'm able to hit another workout the next day instead of like taking 2 or 3 rest days because I'm too sore to work out again, that sort of thing.
No, and it's great because IGF-1 in particular, or CJC of amorelin, is really going to reset your body's cycle of the circadian rhythm, so it helps with sleep. So while you're sleeping, you're able to, that's when you're recovering, right, from your hard day. You go to the gym, you hit it harder, so you excrete all those cortisol levels, and really you get yourself in a regular routine, and that's what we want to maintain long term, right, for overall wellness. The semaglutide, nausea really comes when people don't eat right. So because you are so healthy, that's probably why some of these side effects are less for you. So drinking lots of water, staying away from sugar and carbs is going to be the best option, even before you take the semaglutide, because sometimes that's still in your body. Wine in particular will make you feel sick.
I've heard that people that drink on it or eat fried foods on it are having really bad side effects because you don't have that healthy baseline, so they're just losing weight because they're taking a peptide instead of having the peptide supplement you and your healthy lifestyle.
Exactly, and that's why the consultation is so important, so we can learn about how everybody behaves differently and what we need to kind of change or manipulate. Intermittent fasting is a great way to really help people make sure these peptides work long term. The semaglutide works best that first month. So we really want to make sure we change your eating habits, 21 days to start a new habit. So hey, we've got a month. Let's use the semaglutide to help you eat within a certain window. And sometimes the hardest part about that is not drinking coffee with sugar in the morning and replacing that with maybe a Celsius or something instead so that you're not breaking your fast. You stop eating at 8 p.m. So that you can get a good night's sleep and recover.
Sure, yeah. And Heather was awesome with my consult. I had a lot of questions and concerns. And even after we probably talked for about an hour, even after we made our plan, I had more questions and more concerns. And she's very good with her phone. She's very good with follow-up. And and she'll make sure that she's very thorough in understanding what your goals are and which peptides would help your goals. So Heather actually offers other things. I think CJC is pretty popular, and then there's some for like mind fog recovery, better sleep, NAD. I've heard a few people are on. So do you want to talk about some of those other peptides that you offer as well?
Yeah, so we love stuff for brain cognition. Obviously, that's a hot topic as we get older, but the sooner we can start working on our brain function, the better. So things like NAD and some of our brain peptides are really good for people also trying to come off Adderall. I know for personally, Adderall was like a big thing I needed through PA school and graduate school, and then once you're on it, it's really hard to come off, but it kills someone's personality. In my opinion. And so this was huge for me to really use these brain cognition things to clear the brain fog, help me come off. We have some recovery peptides, which are great for injuries. So people that really, even if you've had surgery or pre-surgery, they're great for that joint recovery. So they'll increase collagen. So all the collagen supplements you take actually work better even on the outside of your skin. I mean, you've got beautiful skin, but it's true anti-aging,
Yeah, that's amazing. So some of the other things that we're adding in, you can't solely rely on peptides. It won't work that way. Again, you'll get the nausea and you'll get bad side effects. So I've been doing a little bit of intermittent fasting, which has worked out really well for me. I'm trying to drink a lot of water. I have a goal to drink a gallon a day. I'm not hitting that goal. It's so tough for me to drink so much water, but I've been working on that. I've pretty much canceled carbs, and I'm not really eating any refined sugar, packaged foods. Again, this is a 2-week plan, so it seems intense to be doing all of these things, but we've only got a couple of weeks. I kind of started a little bit too late. I meant to start earlier, and I tried to do this peptide from another clinic, and it didn't work for me. I don't know what I took, but it made me hungry.
Not all created equal.
So now we've only got 2 different weeks. And why do you think that is?
Yeah, so it really comes down to source, where you're sourcing the peptides. So honestly, I'm one of those people that's like, especially if I'm injecting it in my body, I'm not going the Amazon shortcut. A cheap t-shirt, great, y'all, like put it on. But like if I'm injecting my body, like what is it? It needs to come from a legitimate source. So like go from word of mouth, someone your friend went there, whatever. And we're only built our business on word of mouth. So someone got a result, and that's how it is. And we really care. So we're on all the stuff. We drink the Kool-Aid. Our parents, our roommates, our cousins, like everybody. And these are our friends. So obviously we want you to have the best experience possible. And 2 weeks isn't really a long time, but honestly, at 10 weeks, we'll continue to change your plan. And just to see her progress over the next year is going to be amazing. Personally, I've been on peptides about a year, and it's just changed my life. You don't, have to stay as consistent after about 6 months, but it's just like clockwork. Your body just knows what to do after that. You just wake up feeling amazing every day.
What do you think your favorite peptide that you've been on has been?
Ooh, that's a hard one.
And why?
I know. So what started me on peptides was IGF-1. I just all of a sudden felt good. I was like kind of skinny fat. I just, and it gave me that pow. Like I just was able to wake up and got great sleep of it. But right now I am a big fan of NAD, just because of the brain fog cognition and getting off Adderall. And then I'm going to add one more in. BPC 157 is great for joints and recovery, and it's just something like for skin, nails, hair, but you really do feel it on the inside.
Yeah, absolutely. That's awesome.
And I have to ask you, what have you enjoyed about peptides? Were you scared about the injection, or
I was nervous about injecting myself, and then when I heard I was in the stomach, I was like, ooh, I'm going to feel it in my abs. But you don't. I mean, even we're pretty lean, right?
Yeah.
But you can still pull enough to where you can inject it. The needle is so small. It is almost like a hair. Like you can really barely see it, and I didn't feel it at all. So that was something that I was concerned about. And the nausea, I work in the medical field. I'm in open heart surgeries, and I'm a rep. And so I'm on the car a lot, and I just was thinking, I can't afford to be feeling like I'm going to pass out or feeling dizzy or nauseous. I really didn't get any of that because I'm eating properly on it, and I'm hydrated. And the very first day I did feel nauseous, and I got scared to do the IGF-1 because I thought this might be too much. That lasted for maybe a minute. It was probably 60 seconds. It felt longer, but once I took the Zofran, I was totally fine, and then I didn't get that nausea again, actually.
Yeah, and honestly, the only true side effects are from the Semiglutide or the tirzepatide. If you just take regular peptides, there really are no side effects. Some people might get a headache from low blood sugar, but overall, those just make you feel good. So the only one we really have to combat is the semaglutide, but as soon as we can, that's the first one we take you off because it's just maintenance after we get that little bit of,
Right.
you know, weight off that we all are ready to get rid of.
Right.
And as far as putting it in your stomach, I mean, Maddie's got some insane abs there, but we can also put it in your thigh, your arm, or your upper glute. I tend to tell people that are on the thinner side to put it in your upper glute. It's a little better.
That makes sense.
So,
yeah, absolutely. Well, we are going to have you come along with us for Miami Swim Week and see the progress. We'll probably get some comments below. Feel free to ask us anything, and we can come back and readdress it in maybe a month or two, something like that. I'm going to put Heather's handle here below. And then, do you have any other better, like an email or something I can put too? Or?
Yeah, I'll put a website up there for you.
Okay. Yeah, that'll be awesome. Good to see you. I'll drop some comments below. Let us know what you'd like to hear, and we'll come back and answer everything.
Let's get Maddie all looking good for Miami Swim Week.